Hi, this is Chris Sadler. I'm a physician assistant in endocrine practice out in La Jolla, California. One of my topics I'm speaking on at the Meds East conference is thyroid nodules. As you know, thyroid nodules are ubiquitous. They're commonly found in clinical practice, and they're common in patient population. You typically see studies saying that there's anywhere from 50 to 70% of us have a thyroid nodule. They're often found these days incidentally, because we do so much other imaging. So for example, a carotid ultrasound or a neck x-ray or CT or MRI because of neck pain or injury. So these are commonly found. They do need to be worked up though. Fortunately, about 90 to 95% of these are benign. But you want to rule out the ones that might be potentially malignant. The best way to do that is with a thyroid ultrasound. Thyroid ultrasound not only tells you the size of the nodule, but it tells you so much more. You get the consistency. Is it solid? Is it mixed? Is it cystic? You can see whether there's microcalcifications. You can see if there's irregular borders around the nodule. You can see if there's lymphadenopathy in the neck. You can see if there's calcifications within it. All these things predict the risk of malignancy. So a good ultrasound can help you categorize which nodules are suspicious for malignancy versus the ones that are at low risk. Now, the American Thyroid Association, the American Association of Clinical Endocrinologists, and the American College of Radiology all have published guidelines to help you categorize nodules based on these ultrasound assessments, and they give you guidance on which ones need a fine needle aspiration to get some tissue to actually see if they're truly a suspicious nodule that needs either further workup or removal. So in the case of these really benign nodules like a simple cyst, that probably doesn't need to be referred on to a specialist unless the patient's extremely anxious and they don't accept reassurance from you, then reassurance from somebody else may be helpful. However, if it falls into one of these suspicious categories, then those should definitely be referred to a specialist like an endocrinologist or other specialists who will deal with thyroid nodules for further evaluation and possible fine needle aspiration.